So first of all, we will have introductory remarks by WHO and UN Habitat. Secondly, we will present case studies from national and local governments, civil society, partner agencies, and other stakeholders to showcase examples of what you can find in the publication that has the same name, and that we will add the link into this chat. Finally, we will open up the floor for questions and interventions, and we are much looking forward to hearing from you. We would like to ask you to use the raise the hand function if you wish to take the floor during the question and answer session, or the chat function. We will be also collecting questions from the chat. So without further ado, I would like to introduce the next speaker. There is Mr. Graham Alabaster from UN Habitat. He's the head of the Geneva office. And Graham, you have the floor for your opening remarks. Thank you very much.
Thank you very much indeed, Rita. I hope you can hear me well and see me. I'm delighted to be here on behalf of Habitat and my colleagues, Annika, to sort of kick off this amazing meeting, this launch of this amazing publication on the provision of access to basic services for migrants. Habitat, as you know, as Rita's already said, co-leads this working group, WHO, and the group's been in existence for a good couple of years. And of course, the focus of our work has been from our side, from UN Habitat, to contribute to what we can offer. Of course, basic services covers a whole range of different aspects, some of which Habitat have some expertise on, but housing, mobility, energy, access to water, sanitation, and of course, education and healthcare. So it's very, very broad. But I think perhaps one of the great moves forward in this publication, which we certainly recognise as UN Habitat, is this need to understand that the action at the local level for provision of basic services is pretty crucial. And it's at the local level where we can really integrate all of the different sides. I mean, this is about, on the one hand, of course, working under national government guidelines, but it's also about how local level actors can mobilize that whole range of different actors and civil society who get involved in migrants organizations to improving this service delivery. And this is really what this is all about. We all know that in times of crisis, that people move into urban settings, and there's this huge win-win situation to work out how the two communities mix and how we provide services for all, respecting the human rights. So, you know, there's a lot we've been doing, and in our mandate, of course, the New Urban Agenda, there's a lot going on. In April, there is a highly significant meeting, where a high-level meeting to look at the progress of the New Urban Agenda convened by the Secretary General. So this issue of migrant health and access to services, of course, will be very high on the agenda, but we need to do more. I think we need to ensure that, you know, the implementation of the New Urban Agenda and its application applies to everybody, and we need to be ensure that the post-conflict and disaster situation migrants are included. So I think perhaps the most significant move forward, and it's highlighted very well in this report, is the need for this participatory planning approaches, which of course has been part of UN Habitat's work and in close association with WHO for many, many years, and how we bring these basic services to displaced indigenous populations. The great thing, of course, is that this work alone can go a long way to improve and promote peace and security in these communities, aside from improving their living conditions. So I'm very much looking forward to hearing more from some of the countries and case studies on this report. Just to say, we stand side by side with our colleagues in WHO and Director Santino. We're delighted to be working with you and your team. It's a top priority for us in the coming months and years, and we stand ready to continue. Thank you very much for your attention.
Thank you very much indeed, Graham. And I will pass to Dr. Santino Severoni, the head of the Health and Migration Program, the director here at the WHO headquarters, to also give some introductory remarks. Santino, you have the floor.
Thank you, Rita. Thank you, Annika, and Thank you very much, Graham, for your nice words. Indeed, I can only recall a very nice journey, not only around the work of the working group that today is presenting this wonderful piece of work, but the entire collaboration with Habitat, UN Habitat. In fact, I would like to share 2-3 thoughts, and the first one is exactly related to the group. I like to underline that I witnessed during these past 2 years almost a unique commitment and enthusiasm to try to make the difference in terms of supporting the implementation of the Objective 15 of the Global Compact, which was the main reason why the group was established in 2019 in really boosting, try to influence the action of expanding access of migrants towards essential services. And I have to admit that the task has not been easy, but the group has been growing in these past 2 years and have been also showing very important capability of adaptation, reorganizing in order to be able always punctually to provide right answers to important needs and challenges. So I've been very instrumental for the discourse on the roadmap in preparation of the upcoming MRF, but also now the focus on post-COVID recovery and response, I think is just another element showing the importance of the work of this group. So my first thought goes to the colleagues that Rita mentioned from all the UN agency and international organization been working together on this in these 2 years. Regarding the publication, I'm very pleased for this launching. I'm very impressed by the quality of publication, particularly for 2 reasons. One of the most common challenge we are facing during our daily work on migration, and in our case on health and migration, is really to have the pulse of the situation on the ground, which is really our main or ultimate and most important goal of our efforts. So the idea to build up a document which was able to collect good practices and how countries are acting in including migrants in access to services, either health, education, vocational training, basic public services as a water and sanitation, I think is extremely important. What I really appreciate a positive type of approach and try to document the reality on the ground. In fact, even the language of using promising practices, I think is very important. In our work, too often we focus only on problems, only on gaps, only on what doesn't function. In reality, this document is certifying that we are witnessing a change in time since the starting of the Global Compact. And the other element, which I think is very important, which the document bears inside, is the attempt to focus on how countries, what countries have been putting in place in order to remove legal, physical, financial, information, discrimination barriers experienced by this group of population. So really is looking into practical solutions put in place. And again, going through the publication, you will have a very strong feeling to see that we are really on a changing reality, on a changing situation. I believe that this publication should be, it will be very important in informing also the upcoming MRF, and we should really work together collegially with all the partners of the group in making sure that this is going to be informing and utilized in the upcoming meeting in New York this May. The last reflection I'd like to share with you is related to the section that the publication has on COVID, on practices that have been put in place in relation to COVID. I think this is very important. It's again a picture of the time we are facing, but also is reflecting the large amount of energy and effort that all countries have been putting in place in responding to this huge challenge. When we are coming to the issue of migration, though, the situation tells us that we need to still be focused on doing more in securing access to services, even at the time of COVID, or even preventive or curative service related to COVID response. Our information, our monitoring is that while in one hand, we have seen a world getting well coordinated, utilizing homogeneous type of measures to respond to the pandemic, when we go to the migrant population, still we are observing fragmentation and lack of coordination, where in many cases, countries are experiencing situations which we already know, but really from the scratch. Then we also observe a full portfolio of realities, very pragmatic approach of inclusion efforts to use really a virtual, public health type of approach, and up to the other extreme of the portfolio of situation where not much has been changed. Unfortunately, what we have observed that the larger type of solution put in place was for temporary measures. So measures valid during the time of COVID, but the question is how those will influence an institutional development, how those will be really remaining in changing the situation. So in conclusion, the power in the content of this publication is that there is really a treasure of experience, a treasure of good practice that, and I'm launching this challenge on the table for the partners, then my view is supposed to be further utilized by promoting inter-country collaboration, not only sharing with a document of good practice, inter-regional collaboration, twinning type of collaboration. So really to build on positive practice. Thank you very much to all colleagues. Thank you, Rita. Floor back to you.
Thank you very much, Santino, for these great opening remarks. Thanks to you, thanks to Graham. And right now we are going to have an overview of the publication, the promising practice in the provision of essential services to migrants. And it's with great pleasure that I ask my colleague, Anika, and she has been my colleague for this past months in this working group. So it has been a great journey. Anika, you have the floor.
Thank you very much, Rita, for introducing me. My name is Annika Lenz, and I work for UN Habitat for our liaison office in Brussels. I'm very pleased to give a short overview today of the publication Promising Practices in the Provision of Services to Migrants, which we are officially launching today. Welcome to all. First of all, I would like to thank the members of our working group under the UN Migration Network for their efforts and for the input in the publication. My colleagues Graham from UN Habitat and Santino from the World Health Organization have already given a good overview of the publication, so I don't want to repeat what has been said. But just to underline that the publication outlines a lot of the challenges that migrants face in accessing basic services. And there's a special emphasis also on the particular challenge that undocumented migrants face, because everything is more difficult when you don't have the right papers. And just to say that we've seen that a lot of political will and resources and creativity is needed to improve the situation. And a participatory approach is key. We really need the input from the local level and from the grassroots. And this is why we wanted to put forward some positive examples, some promising practices, as they're called. So around a year ago, the working group requested member states and partners in civil society and migrants organization to submit their practices. And it was very uplifting to see that we received 36 promising practices, which we've grouped around the themes of health, education and vocational training, housing, and water and sanitation. And the practices are really around the globe. And in the event today, I'm very glad to see that we even have some people from the Americas, although it's very early morning for them. So good morning to those of you who joined from Latin America and from North America. I thought you wouldn't be very well presented in the event, but I mean, this region of the world is also quite well represented in the publication, as are the other continents. So the publication really presents creative and innovative solutions, which we will hear straight away. And I would like to extend a particular thanks to Mr. Davide Mosca. He's the retired director of the Migration Health Department of the International Organization for Migration, and he's the one who drafted this publication. And he added a lot of valuable analysis on each of the themes. So I'm very excited that so many of you joined today. We are more than 200 participants, and that we have such an impressive lineup of speakers. I also look forward to a lively debate at the end of the session. Thank you very much.
Thanks, Anika. And we will move now, after this opening part of the program, to the presentation of actually the good practices, what you all came here also to hear. I'm going to, as you know, I have this kind of job that sometimes it's not, the most pleasant one, because I'm going to ask to each presenter to keep, to keep the time, so to keep the 5 minutes established and try to keep it as well as possible. And I will, of course, will not try to interrupt, but time is short. So on the presentation of good practices that are featured in the publication, we will start with an example of Portugal. And here we will have the example of the municipal plans for migrants integration in Portugal. And this will be presented by Mr. Eduardo Coa, the head of the International Relations Unit at the High Commissioner for Migration. Mr. Eduardo, you have the floor now. Thank you.
Thank you, Rita. Excellencies, dear colleagues, I would like to begin by greeting the World Health Organization, UN Habitat and UN Migration Network for putting together those promising practices and for launching the publication during the UN Migration Week. As a GCM champion country, Portugal is always eager to take part on those discussions and to present our national policies and practices. Today, and on behalf of the High Commissioner for Migration, I am very pleased to briefly present our experience with the municipal plans for migrant integration. Portugal promotes a whole of government and multi-level approach that includes the partnership with national and local-based authorities and institutions. Under the scope of its responsibilities, the High Commission, ACM, develops a wide range of activities ensuring a cohesive integration process of migrant populations in Portugal. These are of national nature, but of local contextualization and implementation, and are developed in partnership with national and local-based authorities and institutions. Nevertheless, and due to time constraints, I will focus my presentation on the topic required, the municipal plans. The municipal plans for the integration of migrants reflect the concerted action of the several entities acting in the migration area at the local level, as well as their commitment to integration in the Portuguese society. The Portuguese High Commission has been challenging municipalities since 2014 to create municipal plans for the integration of migrants, recognizing that integration is done at the local level, the need to promote more integration policies at the local level, but also to improve cooperation among the different levels of governance, national, regional, and local, and to promote the monitoring of the services and policies developed at the different levels. I need to highlight an important aspect in our integration policy. We provide services to all the migrants, respectively of their legal status, and this is a key approach in our measures. To support the implementation of the plans, an Immigrant and Diversity Municipalities Index was created as a support tool for the characterization and monitoring of reception and integration of migrants' local policies. Furthermore, ACM created a practical step-by-step guide to elaborate those municipal plans. The plans follow a bottom-up approach, encompassing different entities, namely the migrant associations, guaranteeing the involvement of all citizens, immigrants, and the host society through information sessions, forums, focus groups, public consultations, and surveys. Those plans are policy instruments that outline detailed action plans for migrant integration at the local level. The objective of the plan is to design and implement tailor-made policies that can lead to higher levels of migrant integration. This instrument offers municipalities the possibility of identifying local priorities in terms of the integration of immigrants in a process that is both driven by and rests upon stakeholders' engagement. Municipalities, local authorities, local organizations, and other relevant stakeholders come together to conduct a community needs assessment and determine adequate measures and activities to improve migrant integration along 14 different areas, including welcome services, housing, health, education, training. The plans are managed by municipalities that play a crucial coordinating role in partnership with other local organizations working in the field of migration and should be implemented over a 3-year period. Overall, and since 2015, a total of 62 plans have been implemented in 45 different municipalities. Currently, there are 25 plans being implemented. At the time of their implementation, only 2 plans did not have a CLAIM, a local center for migrant integration. Colleagues, allow me to briefly mention the work we develop with the local centers in close liaison with the municipal plans. To reach a larger number of migrants and refugees who cannot access the 4 national one-stop shops, ACM also manages 141 local centers to support the integration of migrants, which are the centralized reception, information, and support offices which aim to answer to the needs of migrants in different areas, including regularization of the migratory situation, nationality, family reunification, housing, employment, social security, among others. Support in access to education and school integration of migrant children is also provided in these services. To conclude, I want to reiterate our gratitude to the organization for highlighting so many Portuguese practices in the publication we are launching today. This recognition just gave us more enthusiasm and responsibility to deepen our commitment with the integration of migrants and refugees, with a particular attention to those more vulnerable. To this end, we are counting with the UN expertise and encouragement, but also rely on the fruitful dialogue between countries and stakeholders, international organizations, civil society institutions, or migrants' grassroots organizations, and are looking forward to learning from your experiences and suggestions. Many thanks for your attention.
Thank you very much, Eduardo, for presenting this, this experience of Portugal, a well-established one. And it is with great pleasure that we see also, the value of this dialogue, to have all stakeholders here to present and to discuss these specific practices, but not only. So I encourage you, of course, to gather your questions, because all the speakers are going to stay with us if you have, any pop-up question later on. So from Portugal, we are going straight to Mexico, and we will hear from Mr. Jorge González Mayorita, First Secretary at the Permanent Mission of Mexico here in Geneva. And Jorge will present us the good local practices to protecting and integrating migrants during COVID-19. Jorge, the floor is yours. Thank you.
Thank you very much, Rita, and greetings to all the colleagues that are joining us today. Let me first start by thanking the UN Migration Network for the invitation to Mexico to be a speaker of this very important conversation. Dear colleagues, the provision of essential services for migrants, regardless of their migration status, as was mentioned by my colleague from Portugal, is a central component of well-managed migration. Essential services are key in upholding the human rights of migrants. They also facilitate their empowerment and integration into the local communities. You will agree with me that when migrants are well integrated, they are in a better position first to contribute to their origin and destination countries, and second, less likely to suffer rejection and discrimination. And nowhere is inclusive access to services as important as it is in cities, where the majority of migrants live, work, and study. I want to recognize now the Network's Working Group on Access to Services, co-led by WHO and UN Habitat, for producing a quality compilation of practices in this area. This document is a useful benchmark to reflect on what countries are doing to achieve the inclusion of migrants, what could be improved, and what new approaches exist based on best practices from around the world. Mexico was eager to provide inputs for the preparation of this report. Dear colleagues, one of the practices of the report I want to highlight today is practice 12, which relates to the local policies to protecting and integrating migrants during the pandemic. A practice that is aligned with Objective 15 of the GCM, which is of very relevance for Mexico. The pandemic revealed the enormous inequalities that migrants face and the risks that exist when there is no inclusion without discrimination of all members of society into national policies, programs, and services. The pandemic also showed the important contributions of migrants to cities. So in recognition of these challenges and opportunities, cities and state governments in Mexico undertook different initiatives to protect the health and the rights of migrants in this particular context. And if you allow me, I will highlight a few examples that are also reflected in the document that was presented today. So the first one, Mexico established migrant integration centers, which are facilities that provide migrants with essential services in the northern border of the country, so in the border with the United States, including emergency assistance, shelter, healthcare, psychosocial support, food, education, employment orientation, and legal advice under a whole-of-government approach. These centers were crucial to reduce the spread of COVID-19 infections, since they were included in the public health measures to respond to the pandemic. These centers have assisted around 7,000 migrants only in the last months. The second practice, some states' governments have consolidated all the public services that are available to migrants in a one-stop shop, with a special attention to migrant returnees in order to support their smooth and prompt reintegration into the Mexican society and economy. The third practice that I would like to highlight, some cities have focused their attention in training the staff of migrant shelters to ensure a full understanding of the pandemic risk for migrants in specific, and also to promote adequate prevention practices. Other cities have offered business training for migrants, some of who have been impacted by the loss of jobs and livelihoods during the pandemic. The purpose of this training is, of course, to increase migrant self-reliance. Now, in rolling out these initiatives, we also identify very specific challenges that I would like to highlight now, and that need to be addressed in order to ensure that this type of initiatives and policies are sustainable and effective in the long run. The first one is to make reality the whole of government principle of the GCM by putting in place coordination mechanisms between all relevant ministries and promoting effective collaboration with local governments and actors. The second challenge or lesson learned that we have is working with other actors is really key, particularly civil society. These organizations know the realities in the field, and they can help shape, implement, and monitor programs and services. The third one, it is important to create awareness in the community and among institutions about the particular needs and vulnerabilities of migrants and the value of inclusive and non-discriminatory approaches. And the last one, successful inclusive policies require good data as well as human, financial, and technical resources. Just to conclude, let me say that Mexico is currently benefiting with resources from the Migration Trust Fund aimed at strengthening the socioeconomic integration of migrants in Mexico City specifically. This joint program is being implemented by ILO, IOM, and UNHCR, and includes a mapping of inclusive services, capacity building for institutions, among other aspects that we think will contribute to close the gaps and address the needs that I have identified. And with this, I want to conclude and just appreciate the organizers of the event for the invitation. Thank you very much.
Thank you very much, Jorge, for this presentation and for giving us a perspective on several here good practices in Mexico on health, on education, among other sectors. So thank you so much for this. And from Mexico, we are going straight to Thailand. And we will present the good practice migrant-friendly services in Thailand. And to do so, we will have Ms. Khairat Koziayiporn from Thailand. And she is from the health policy program exactly in Thailand. So Khairat, you have the floor. Thank you so much.
Thank you, Rita. Can I share my slide?
Yes, please.
Okay.
And we are seeing your slides.
Okay, thank you. Okay. Okay. Good evening from Thailand, and thank you for having me here in this meeting. And on behalf of the Non-Thai Population Research Unit, International Health Policy Program, Ministry of Public Health Thailand, I would like to share the Thai experience about the migrant-friendly service. As we know that Thailand is the most popular destination country for migrant workers in Southeast Asia, and most of them are from Cambodia, Myanmar, and Laos or Vietnam. The migrant-friendly service is a policy that responding to the migrant needs in order to reduce the language, culture, and financial barriers. The new registration process or one-stop service is a policy initiative that we try to improve access to migrant health insurance. In Thailand, we have two types of migrant workers. The first one is the documented migrant. They are imported under the mutual agreement between Thailand and other countries. And another group, they may be illegally going to Thailand, and we allow them to register at the one-stop service. During that process, they have to apply for the work permit and then the health insurance. In Thailand, we have two types of health insurance. The first one is, we call it social security scheme. This is similar to Thai people. And another one is this, we call it health insurance card scheme. This is for the migrant worker who working in the informal sectors and their dependents. All of the migrant who already registered in the health insurance, they can access to healthcare and at the registered health facilities, and they get the similar benefits package, similar as Thais, except some high cost services which is not covered, especially in the health insurance card scheme. Another one that I would like to present is this, we call it the Migrant Health Worker and Volunteer Program. Is the policy that we try to reduce the language and cultural barriers. There are two types of them. This program is began in 2003 with a collaboration between the public organization and NGOs. And the volunteer, they have to pass 20-hour training course, and then they have to assist and coordinate with the health staff and communicate the health information between migrant and health staff in the community. And the migrant health worker, they have a different role. They should be the person who can speak both Thai and origin language, and they have to pass the 40 hours training course, and they will be an interpreter, the health assistant and mentor of the migrant health volunteer in health facilities, and they also get paid for their work too. This program is mostly funded by the health insurance card scheme and NGO budget, and the training course is supported by the Ministry of Public Health to be the standardized manuals. And the courses include like many knowledge about like Thai culture, the law or policy that relate to migrant that they have to know, or like basic hygiene knowledge. And this is in Thailand, we face off like the COVID-19, and the second wave of the COVID-19 case is originated from the migrant populated area, and migrant health worker and volunteer, they play important role to reduce the number of cases. For example, like they can observe, they can monitor the suspected case in the community, or they can like record the vital signs or like the symptom, or can like interpret the information between health staff and migrant patients. So they are contribute a lot to reduce the problem in Thailand. And another contribution, they also join we call it like migrant hotline. It is a call number that migrant can call and can speak with the migrant workers, and then they can like ask any question about their concern, access to healthcare, or anything about the migrant-related policy at that time. I would like to find out like the lesson learned from the migrant-friendly service in Thailand. I think we improved the access to migrant health insurance by introducing the one-stop service policy. And however, we still like face off some problem because health insurance card scheme is a voluntary like basis. So maybe some of them are left behind, especially the undocumented one. And another lesson learned that we try to improve the access to health service by introducing the migrant health worker and volunteer program to reduce the barriers of the language or culture. However, there is still a problem with the sustainability of this program in terms of funding and capacity building. So for example, like the funding is now from the health insurance card scheme, which is very small number of budget. So the government have to explore like more policy options to deal with this. And we can like expand the professionalism role of the migrant health worker and volunteer to make them like be more standardized, more professional, and then like receive some benefits when they work for us. And I think migrant-friendly service is a key component of the migrant health policy, which is necessary to consider the migrant needs, which is different based on each context. And all of this will lead to the universal health coverage for all. Thank you.
Thank you so much, Harat, for this health practice, for presenting it. It was indeed very interesting to assist on the Thai example related to also migrant-friendly services. And from Thailand, we are now going very far. We are going to Laos, and we are going to present one of the practice provision of WASH infrastructure and service at quarantine centers in Laos. And this is going to be by Mr. Avi Sarkar from UN Habitat Laos. Avi, you have the floor. Avi? Probably as my colleagues also see if Avi is having any problem, any technical problem, we can move to the next speaker and then we will go back to Avi. So we will actually now talk about practice related to education. So we are going to Turkey after all, and we are going to discuss the School on the Move in Turkey. And this is going to be by Ms. Tuba Hildiz from the Turkish Red Crescent. Tuba, you have the floor. Thank you very much.
Thank you, Rita. Let me please 1 minute for sharing my screen.
Of course. And we are seeing Tuba. Here you
Thank you
go.
very much. First, I want to thank the organizers for such a platform and publication that enables us to learn from other humanitarian actors. Sorry, I will make it. Yes. In Turkey, Turkish Red Crescent have founded child programs after the Syrian influx in 2013 in order to provide some services, child-specific services for Syrian children. And these services are located in the cities where Syrian population highly settled, like the southeast of the Turkey, as you can see in the map. We have like we have 4 models that we are working for the children. One is the child protection centers, the other one is the community centers, the other one is mobile units, and also we have child-friendly spaces in the temporary accommodation centers, which are called camps. We have implementing some prevention programs and also some response programs for the child-specific risks and problems they are facing in their daily life. You can just see the details here, but I will skip this part. Sorry, I think you cannot see
Yes,
the
Tuba. Apologies to
presentation.
interrupt. We are not seeing it at presentation mode. Yes, now we can see the programs. Now the slides are moving. Perfect. Thank you.
Sorry, I will try again. Is it okay now? Can you see my slide?
Yes, not in presentation mode, but we can see your slides.
Okay. Is it okay now? Can you see it? Can you read it? Programs?
Yes. Yes.
Okay, sorry for inconvenience. We have, as I have mentioned, we have mobile teams, and these are trucks that are designed in safe spaces, and also we have minibuses. We are calling them like mobile PSS teams, and these are also carries personal and required equipment for the activities. School on the Move project is the project that we have started as a response to the school closure due to the pandemic in Turkey. After the school closures, Ministry of National Education has started a distance learning platform, which is called EBA in short, which have 2 components: online lessons and also a TV channel. But as you can guess, seasonal agricultural workers and disadvantaged children couldn't reach these 2 components of the ministry. So Turkish Red Crescent has started provision of tablets with internet connection for the children in order to make them to be able to reach the educational channels. But these are not permanently given to the children, but they were donated. I will just show you a small video. Please let me know if you can see, because I'm not sure. I have a technical problem.
Yes, we can see.
Can you see?
I think Tuba, although we could see, I think
Okay.
he's not moving forward. So may I suggest for you to put the link of the video on the chat?
Let me try again.
Okay, let's try.
Again. Is it okay now, Rita? Okay.
Merhabalar, ismim Hale Öztürk. Türk Kızılay Çocuk Programları Koordinatörlüğü bünyesinde faaliyetlerini yürüten mobil çocuk dostu alanda görevli gençlik çalışanlarından biriyim. Salgın sürecinin devam etmesinden kaynaklı yeni eğitim öğretim yılında EBA uzaktan eğitim platformu hayatımıza dahil oldu. Biz de tablet, bilgisayar, internet gibi imkanları olmayan veya bu imkanlara erişim noktasında sıkıntı yaşayan çocuklara destek olabilmek adına alanımızı ve internet, tablet, bilgisayar gibi imkanlarımızı çocuklarla paylaşıma açtık. Şu an Gaziantep'in Nurdağ ilçesindeyiz ve hem mobil çocuk dostu alanda hem de 2 farklı okulda açmış olduğumuz uzaktan eğitim sınıflarıyla çocuklara destek olmaya çalışıyoruz.
Within this project, we have just shifted our mobile teams from protection programs to education programs. It was just a short-term program for us, but it was successful. So as TRC, we can implement this project in case of disasters or if there is a need in remote areas. Also in settlements of the seasonal agriculture people, workers in the future. We have enabled, this project is enable us to reach many children that are under risks. And also we have a chance to implement online programs such as PSS programs or protection programs and make an impact analysis. So implementing online programs via these mobile teams also via tablets was also first for us. But there was some limitations. The key lessons we learned in this process is can be summarized like that. We need more times for with children in order to see the more effective results. And also we have a limited space inside mobile teams and also in the tents we have just implemented. So we couldn't get more groups, just one age group we could participate in one day, in 1 hour. So it was another, this was another problem. Also, during pandemic, unfortunately, many of the children, adolescents were working, so there was some difficulty to reach out children. And also, we would like to suggest if any organization wants to implement such a project, to include psychologists and social workers, such mobile teams, because children's needs are diversifying, so the interventions should also diversify. Thank you for listening, and sorry for the technical inconvenience.
Thank you so much, Tuba, for sharing this rich experience of Turkey in relation to education, and also for flagging the challenging to actually provide such projects during the pandemic. And then we can move from Turkey to our last speaker. I'm afraid that our speaker from Laos cannot join us due to technical problems. So we will try now the last speaker. And the last speaker is Mr. Mohammed Salam from Habitat for Humanity Jordan. And he will present the practice assisting with the refugee crisis in Jordan regarding water, sanitation, and rehabilitation of buildings. So, Mr. Salam, you have the floor. Tuba, could I kindly ask you to interrupt your shared presentation? Thank you very much. Brilliant. So, Mr. Salam, you have, Mohammed, you have the floor. Thank you very much.
Thank you, Rita. I would like to start by thanking you all for considering our project as one of the practices for water and sanitation sector. Before I start talking about our continuous project, since we are in the second phase now, I would like to get you into the context of Jordan. Jordan was receiving many waves of refugees and migrants, the Palestinian in 1948, and 1967, the Iraqis in 1990 and 2003, and the Syrians in 2011. Jordan's current population is approximately 11 million. 1/3 are considered as guests, non-Jordanian. The large number of refugees has created extreme pressure on housing availability and affordability for low-income households. Almost 2 million Jordanian and Syrian refugees live without access to affordable housing in host communities. On top of that, Jordan ranked second water poorest country in the world, faces an absolute water shortage by 2025 following the current trend. COVID-19 pandemic forced a new lifestyle and unexpected social and economic challenges. As from the World Bank, the unemployment rate is on the rise. However, in the first quarter of 2021, youth unemployment rates reached 48%, and women's labor force participation at 14%, one of the lowest in the world. So people at that time tend to give more focus on securing basic needs for their families, like food, education, and medication, rather than any other needs. Homes with poor conditions negatively affected people's health and their psychological status. There are many reports that shows evidence for domestic violence has been increased. The harsh implication put more responsibility on Habitat for Humanity Jordan to transform the shelter interventions from long-term development since 2002 to more humanitarian response interventions since 2017. The Middle East Response to Crisis Initiative, the Mercy Project, has two main pillars. The first one is considered at household level by direct rehabilitation interventions. And the second one is rehabilitation and expansion for communal projects in the area of implementation. As a highlight from the first pillar, we are talking about 320 households, 50% Syrian, 50% Jordanians. 450 socioeconomic assessments were conducted by our social workers. Using our rich service mapping and valuable network with many NGOs and local CPOs, 108 households were referred to other service providers and receiving different assistances. Mainly, we are talking about the finance, the health, and education. 400 technical assessments were conducted by our engineers. More than 750 home visits were conducted by our team. 92% of the rehabilitation work was related to wash and sanitation, and 72% toward saving energy. Using the 5 pillars to evaluate our activities, which include the safety measurements, the work duration, the quality of used material, type of work, and the implementation team, and the overall satisfaction from our beneficiaries is more than 90%. As highlights from the communal project, we are talking about 21 projects that have served more than 15,000 individuals in the east of Amman. 12 different purposes CPOs, 4 schools, gym for people with disability, shades for waiting areas, sidewalks, rainwater drainage system, and community gardens and parks. From this position, I would like to share some recommendations to donors and the international community. I would start talking about promoting some policies and systems that advance access to adequate affordable housing, dedicate funding to respond to the shelter sector as core sector, including funding for public service facilities that targeted displaced and host communities, underscoring the requirement of working with and support national governments to meet the growing needs through financial and technical support. That's all about the project, and I will keep my contact in the conversation in case anyone have any question or for more coordination. Thank you, Rita, and thank you all.
Thank you very much, Mohammed, for presenting this practice. It was the last one, but again, very rich. I think we got here several presentations, really rich. And I think right now is the time that we are much also looking for. I have to say that we have 4 minutes until the end of this webinar, but probably we'll keep a little bit more, probably 5 minutes, to open up now the discussion to the floor, because again, it's also a richful experience to hear from you and also hear if you have some practice and experience. I will kindly ask you to keep it short to allow as many people as possible into this round now of questions and answers. And I will again say that you can use, of course, the chat function, or you can use the raise hand function. As you know, I think we are all now pros on Zoom, so it's quite now easy for all of us to reach the raise hand function. But anyhow, we have these two possibilities. So I'm just going to give a couple of seconds for people to react. I know there are colleagues from the working group also, they wish to take the floor, but I was going to just allow this, 30 seconds wait to see if there is any question from the floor. And while the questions pipe up, I want to actually thank, because we had a very interesting, geographical representations here in this event. We have people from Libya, Chile, Nigeria, Ghana, Spain, Turkey, Portugal, Thailand, South Africa, US, North Macedonia, Egypt, Indonesia, and Ethiopia, and just to refer some of them. So now I think we have a question from the floor. So I will ask my dear colleague, Cristina Profili from IOM, to join us here and to ask any question or to give any comment. Cristina, you have the floor. Thank you.
Thank you. Thank you, Rita. And let me lower the hand. Okay. First of all, I want to really thank you, the UN Migration Network, and to organize this webinar and to really put together this important document. I found that is very inspiring to see the action at country level, because as Santino commented at the end, that's the place where we need to see the change. As you know, IOM is very active, has been very active in the last 13 plus years at the country level to support member states, to support migrants, and to assess the health services, and not only, the basic services. I fully agree. It's just a reflection also with Santino that what we have seen with COVID, that despite a lot of effort, despite good example, despite good practice, these are still temporary. So they are not really a permanent solution. I really hope that, of course, the solution is, we know very well, is in the commitment of SDG towards universal coverage, because in terms of health, if country would have universal coverage, we will not be here to discuss what services to assess and why services has to be assessed. So I really hope this network and also the IMFR, the coming meeting in May, would really elaborate more and to see how really country can move forwards in the achievement of universal coverage. And sensitive migrant services are fine, but still temporary solution. The portable, we call it, health packages, benefit are also portable solutions. So the question is, when migrants move to another country, it's really their life. It depends of what country are able to offer. I'm happy that we have in our region. I'm working I'm based in Brussels, and covering the European Union Economic Area and NATO, for having Portugal and of course Luxembourg as two champion countries in implementing the Global Compact on Migration. So I'm quite sure that the good example of these two countries, among, of course, many other, that I hope they will reach the stage to be champion. I hope all countries we really put forward on this health agenda. I'm also glad of the collaboration we have with WHO, and I believe that is the key issues to work together, the three levels of each of our organization, but also especially the country level. Really, where we have country office, we don't have, have IOM and WHO working together and to make sure that the global compact on migration is implemented, and especially to put emphasis on the health. We see what's happening when we lose health. People don't realize until we lose. I think the world has experienced this, all of us. Of course, all of us want to forget, but I hope that we will take in our mind at least this lesson to reach the most vulnerable, that still remain most vulnerable, which are the migrants. So I wish you all the best for this platform, this important platform. Count on us, count on IOM, on being your best alliance and partners for this work, and we will continue discussion. Thank you.
Thanks, Christina, for these words, and thank you so much for all the collaboration that we have ongoing with IOM, especially on my side as I reflect the health part of it for the health and migration. So from Christina, IOM, I'm going to Nicole from IFRC, and then also David Mosca wants to speak, but probably David, I'm going to get the ladies first. So Nicole, you have the floor.
Thank you, Rita, and thank you, colleagues, for the opportunity to share a few points from the International Federation of Red Cross and Red Crescent Societies, and echoing a lot of what has been said already by the presenters around the need for access to services irrespective of status along migrants' journeys. One of the ways in which the Federation is working to do that is in collaboration with our network of national societies, is to establish humanitarian service points at strategic locations where migrants are moving on their journeys. We currently have around 275 humanitarian service points across 42 national societies around the globe, and these are safe, neutral locations where migrants, irrespective of status, can access essential services without fear of arrest or detention. So it's about creating a local space where all migrants are able to safely access their services, which range from information to emergency and medical health care to psychosocial support. And it really is harnessing the power of local organizations, of working collaboratively with local authorities, with local communities, to make sure there is a safe space where migrants can access, and particularly people who may be undocumented or irregular have access to those essential services. This practice is mentioned in the Promising Practices document, and it's something that we wanted to draw attention to as well, as it aligns with much of the work that's being done by actors in the working group to ensure equitable access to essential services for all migrants, irrespective of their status. So the only thing I would add to that is I think we had a critical moment in terms of the IMRF coming up. So a real opportunity to take this Promising Practice document to look at what might be applicable in our own local context and draw on that for conversations with governments to see how we can strengthen the implementation of Objective 15 of the GCM. Thank you.
Thank you very much, Nicole, for these words. And I have to say that just, going through the chat, I can see your, and it's great from our side, your enthusiasm, not only for the publication, but also for this event. So on behalf of the colleagues, thank you so much. And now, before I reply to even and put some of the questions that are in the chat also to our panelists, let me give the floor to David Mosca. David, it's a pleasure to have you here today, and you have the floor. Thank you so much.
Thank you very much. And just because I was mentioned, I felt the duty to say a few words. First of all, it's been a privilege for me to pull together these very interesting practices and study through it and try to highlight what is the commonalities, what are the lessons that all of us can bring home. And I want to mention a few. First of all, though the practices have been separated by thematic domain, the majority of practice in reality are multidisciplinary. And this demonstrates, that we need to look at the human being more than the sector in which we are involved, the need that people have. And definitely the practice show that these needs are better met when there are multi-sectorial. At the same time, look at the housing, education, health, and so on. And this call all of us to partnership. We cannot act in isolation in silos. The second point is that there is a strong link between objective 15, as we know, objective 16. So between the enjoyment of services and the integration. This call also for more discussion between service providers and policymakers. They have to work together. They have to talk. Even service providers in a sector can make a difference in enabling policies. And again, sometimes some countries have shown conducive integration policies that certainly are a major enablers for the enjoyment of services. This is the case of Portugal, for example. But on the other hand, the enjoyment of services, even when an integration policy doesn't exist, the enjoyment of services are a mean to go towards integration. Children that are educated, people that are healthy and then can work and then become autonomous, they can, better integrate. So even when there are no policy for integration, the enjoyment of services are important. And this calls all of us in our sector operation to do things. Third, is another point. Even when the policies are there and the services are there, they have to become accessible. And that is not always the case. Barriers need to be overcome. And you have mentioned, the mobile team, the service along the migratory patterns, as IFRC is doing with humanitarian service points, or services offered where they are needed in border areas, or very smartly putting on the same roof different services to become better accessible instead of expecting people to navigate system. And last, I would say when you provide service to migrants community, strengthen the system that provides service to everybody. Win-win situation. We have the case, for example, in Ethiopia and Gambela, where wash services have been offered by ARA, UNHCR, UNICEF to refugees, but at the same time to local population. Last, I want to mention the human rights and the humane dimension. You will read through a practice called the Last Right Project, okay? So this is an assistance given to deceased migrants' families in their repatriation of bodies, identification of bodies, bereavement and mourning, because this brings back also to the humane dimension of the issue. So in conclusion, there are so many lessons learned beyond the individual practices that come exactly from the wealth of all these, understanding what is behind the practices. And certainly there's still a lot of work that we need to do to analyze, understanding and proper and spread, what can be done in the future. Thank you very much.
Thanks, Davide. I just wanted to ask Tuba if she can quickly reply to a question that is in the chat before I close this session. It will be if the children's centers got free access, or are they secured to make sure that all children are safe? And this is a question that came through the chat. I don't know, Tuba?
Yes.
Okay, perfect.
Yes, child centers, child protection centers are providing services such as PSS programs, child protection programs, education programs, etc. All of them are free. All of them are available for refugee children from any country, or also from the host community children, which has some difficulties to reach out to such programs.
Thanks, Tuba, and thank you very much. So, dear colleagues, here we got a little bit, ahead of the time, 11 minutes, but I think it was for a good cause. Let me just thank you on behalf of WHO and also of UN Habitat and the UN Network to thank you all for having the time to be here with us today. It was a pleasure. Thank you very much for the words of Graham, of Santino at the beginning. Also to all our panelists, they were amazing. And also Davide, thank you so much for the inputs. Thank you also for colleagues that again have been hand in hand working with us in the working group Access to Services. And I wish you a lovely day. And once again, thank you very much.
Thank you. Bye-bye.
Thanks, Rita. Invite everyone. Thanks for joining. Have a good day.
Thank you very much. Bye.
Bye.
Thank you. Bye.
Bye-bye.
And we will share the recording. Someone asked. Yes. Thank you very much.
Thank you. Thank you.